Hey folks, this is Dave Smith at Correctional Officer Lifestyle. This video is actually a requested video. One of my subscribers, Stan McCrae, has actually requested a video about chest pains. Now, I asked him to quantify what about chest pains. You know, are we talking staff chest pains? Are we talking inmate chest pains? Are we talking chest pains related to stress for correctional officers? And he answered that we want to do a video about inmates using chest pains as a means of manipulation. So that's what this video is going to be about. I have notes off to my left as usual so that I can stay on track, because I love going down rabbit holes. I'm real good at going down rabbit holes, so I've got these notes off to my left to help keep me on track. Okay, chest pains as a means of inmate manipulation. And I want to put this out there on Front Street, right on Front Street. Treat every claim of chest pains as though it's a heart attack. The moment that you do not treat the claims of chest pains seriously, and the inmate passes from a heart attack, the agency, and you personally can be held liable for that inmate's death, because that inmate told you that he was having chest pains and you did nothing. Now, I want to just go on ahead and further and say that sometimes when you're dealing with issues of chest pains and issues with the heart, you can do everything right and the inmate still die. Okay, to give you an example, we had an inmate come up to one of our sergeants on the recreation yard one day. It was in the middle of the summer. We're in Florida. It was blistering hot. The inmate came up and said, "I don't feel good, Sarge." Sarge took him into the shade, took him into a shaded area, made him sit down, made him lay down, got him some water, used half of the water that was brought to put inside the inmate to help rehydrate him. The other half of the water that was brought to him, he put on the outside of the inmate to help cool him off. Notified medical via radio. Medical's response time was less than 5 minutes. That is generally better than you're going to get an ambulance to you on the street. The inmate was put into a wheelchair, and they were going to medical with the inmate. The inmate was alert. He was talking. He was holding conversations. He was joking around. He was happy. He was receiving medical attention. When they got him into the medical department, Sarge went back to work. His job was done. You know, there's nothing that he can do in the medical department. Medical staff is there. You've got nurses, you've got a doctor, you've got a working infirmary, everything else you could possibly want in there. Sarge called 2 hours later, asked how the inmate was doing, and was informed that the inmate had passed away. Sarge did nothing wrong. Everything was done correctly. It was just that inmate's time. It was just his time. Nothing you can do about that. Sometimes when you're dealing with matters with the heart, specifically in chest pains, you do everything right and it works. You succeed. Specific case in point, we had an inmate self-declare a medical emergency because he was having chest pains. He goes to the medical department. They take vitals on him. The vitals come back not quite right. They do an EKG on him. The EKG comes back not quite right. We activate EMS, we get the inmate into an ambulance. I'm riding in the ambulance with the inmate, and they find out that through looking at the records that this inmate is actually a heart patient and has nitro. And the paramedic called the doctor. Doctor said, go ahead and give him a nitro. Gave him a nitro. 30 seconds, 45 seconds later, they checked his blood pressure. It was 50/0. So that's not good. Inmate was still alert. Inmate was still talking to us, but his blood pressure had bottomed smooth out. We turned on lights and sirens and started really getting to the hospital in a hurry. And inmate spent a week in the hospital, came back to the institution. He was washed in medical for another week. He was fine. So sometimes you do everything right and it works. Sometimes you do everything right and it doesn't work. Okay? It is and I'm going into a lot of detail with chest pains because we have to take them seriously. I'm giving you reasons why we have to take them seriously, okay? Chest pains often accompany issues other than a heart attack. Anxiety can give you chest pains. Being overly full, you eat too much, that can give you chest pains. Having a problem in your upper gastrointestinal tract, your upper GI, can give you chest pains. Muscle soreness from working out either too hard or too much can give you chest pains. Too much caffeine can cause heart palpitations and chest pains. There's any number of things that can cause chest pains. On the flip side of that, oftentimes heart attacks occur with zero symptoms. You don't know they're coming. It's just 1 second you're up, the next second you're down. There's no chest pains, there's no shortness of breath, there's no tightening of the left arm, there's no tingling in the fingertips, nothing like that. To accentuate that point, we had an inmate out in our confinement unit, and back when I first started, it was common practice. We kept a box of sporks, which is the spoon and fork combination, salt, pepper, and napkins. And we would bring an inmate out and set him in the interview room. One of us is sitting there with him. The inmate would spork, salt packet, pepper packet, wrap it up in a napkin, put it in a box. And that's what we fed chow with. That way, whenever we give an inmate a tray, we hand him that. He's got a napkin, a spork, salt, and pepper, all right there. And it let the inmates that don't give us any problems come out of the cell for a little bit and talk to us, roll sporks, and do whatever. And we had an inmate out rolling sporks one night, and Sarge was in there talking to him. He was in there talking to him, and the inmate stopped talking, looked at Sarge, looked him square in the eye, said, "Uh-oh." Just like that, "Uh-oh." Hit the ground. Medical said he was probably dead when he hit the ground. Massive heart attack. What is often referred to as a widowmaker. Sarge did everything right. He did everything right. He got on the phone. He got on the radio immediately, got medical en route. Medical got EMS en route. Sarge was doing chest compressions when medical got there. This was back in the days, I know I've been there since the Stone Ages. This was back in the days before we had automated defibrillation devices, automated electronic defibrillation devices anywhere. And so we didn't have an AED. Sarge never stopped doing chest compressions except for to get the inmate from the floor to the gurney. Sarge climbed on top of that inmate and was doing chest compressions while the nurses were offering rescue breaths through the bag and the mask. The inmate passed. No warning, no chest pains, nothing. The inmate passed. Everything was done right. It was just his time. Now, to the heart of the issue. And that is inmates using chest pains as a manipulation tactic. Okay, we had an inmate that at least once a week would declare he was having chest pains in our confinement unit in order to be taken to medical or to have medical staff come see him. His intent, as he verbally stated to me, was to have a nurse, was to sexually assault a nurse. That was his intent. That was his plan. On one such occasion, we pulled the inmate out. Now, in our confinement unit, we have a room. Medical has a key to the room, and it is an examination room. Everything medical needs to perform an examination is inside that room, with the exception of an echocardiogram machine, EKG. In the event where EKG needs to be done, we have to take them over to medical. They had been called over for this inmate so often that they came over and did the examination in that examination room. And while they were doing the vital signs, because normally when something is wrong with your heart, it's going to show up in vital signs. While they were doing the vital sign check, the inmate, who is restrained behind his back and restrained with shackles, which is our policy when it comes to confinement inmates coming out of their cell and going to medical, had a sergeant on his left arm with a custodial grasp, which is a grasp above the elbow around the arm, and an officer on his right arm with a custodial grasp. This inmate attempted to lean forward and kiss the nurse. They ordered him to stop. He persisted. The nurse pushed him away. He persisted. It ended up they had to use force on this inmate to keep him from sexually assaulting this nurse. And he got them over there claiming he had chest pains. This particular inmate would do everything he could to get medical attention, to get the nurses over there where he could do this. It got to the point where if we had male medical staff on standby, male medical staff came over to deal with him. We didn't allow female medical staff to come over to deal with him, and that curbed a lot of the problems we were having with this particular inmate. Another thing that I hear a lot when it comes to what I believe is manipulation is specifically younger inmates telling me my heart hurts. Like I mentioned earlier in this video, there's a lot of things that can cause chest pain. Anxiety, too much caffeine, working out too hard, upper GI issues, you ate too much. A lot of things can cause chest pain for a young individual, 19 to 21 years old, to be able to look at me and say, my heart hurts. That sends up a red flag of manipulation right off the bat. Do I not take him to medical? Absolutely not. I take him to medical every single time. Somebody says they got something wrong with their heart or their chest, they go to medical. End of the story. Period. I am not a doctor. I am not a doctor, and I am not going to give my career to an inmate's family because I failed to act when an inmate said something was wrong with his chest and he passes away. No. I am taking that inmate to medical every time. Okay? By and large, people don't know that it's their heart giving them problems unless they've had prior experience with their heart giving them problems. And while 18 to 20-year-olds generally don't have those issues, they can. And one specific instance made me rethink my position on younger inmates claiming they're having chest pains or claiming my heart hurts. And it was an inmate that died in his sleep. I was on a tour I was working a shift. I wasn't on my tour yet. I was working a shift down at the work camp, and it was a night shift. And inmate passed away in his sleep. Wasn't even 30 years old. He's gone. He did not approach staff, tell them anything was wrong. He did not complain of any chest pains. He didn't tell any other inmates he was having any issues. He laid down in the bed, covered up, and went to sleep. He never woke up. It wasn't until the sergeant was doing his tour of the dorm in the morning, trying to get everybody up and get their beds made, that he discovered that this inmate was gone. Nobody did anything wrong. We did not miss any of our required checks. We did not miss any of our required counts. Far as we knew, that inmate who was covered up on his side in his bed was asleep. But because of his young age and the fact that he had a heart attack and died in his sleep, it made me rethink my position on younger inmates coming up to me and telling me I have chest pains. Now, it just so happens that what I was told later, not by any medical personnel, but by investigators, is this person had a history of being arrested for drug-related charges. So, juvenile record aside, this dude loved to get high. And I imagine the amount of drugs that he did throughout his lifetime probably damaged his heart beyond repair. So you have to take them all seriously. Yes, inmates will use chest pains as a manipulation tactic. Specifically, you're going to find more problems with chest pains when it comes to an institution-wide lockdown, a dorm-wide lockdown, confinement unit, or the inmate was told he can't do something that he wants to do, and he's trying to get out of the dormitory to go do what he wants to do. If you have an inmate tell you, I'm having chest pains, and while you're getting ready to escort him to medical, you notice that he reaches down and picks up his canteen bag. What does he need a canteen bag for if he's going to medical for chest pains? He's going to medical to be told he's not having any issues, and when he comes back to the dorm, he plans on going to the canteen. Several times, inmates will declare they're having medical issues in order to get what they want. Chest pains is one that I wish they'd leave alone, because an inmate injuring his knee is probably not going to kill him. An inmate injuring his foot, probably not going to kill him. An inmate injures his hand, probably not going to kill him. He's got a headache that's persisted for 6 hours. He's taken Tylenol. Could conceivably kill him, but it's probably not going to be as immediately life-threatening as an inmate having a heart attack. My fear, my worry, is these inmates that continually cry wolf, and they're using I'm having chest pains as a manipulation tactic, are taking away an officer's urgency in their response to an inmate that is actually having chest pains and may pass away. We're human. We're human. Those things happen. It's not our intention to diminish anybody. It's not our intention to dismiss somebody having chest pains. But after you have so many people claim chest pains just for nefarious purposes, it's human nature to feel that all of the inmates are declaring they have chest pains for nefarious purposes. I guard against that. I warn against that with my staff. I don't want them to go down that road. There are things that we can do to curb inmates using chest pains as a means of manipulation. And I'm only going to go into one of them. And it's in the state of Florida. We have a disciplinary report that we can write that is feigning an illness. If an inmate feigns an illness in order to commit an infraction or a rule violation of the rules of prohibited conduct that are listed in the Florida Administrative Code, Chapter 33, then we can write them a disciplinary report for that. However, I want to caution anybody that's in the state of Florida, that disciplinary report written by security staff carries very little weight when it comes to the appeals process. If you write that report that an inmate is feigning an illness, make sure you get a witness statement, a signed witness statement from the medical staff that determined that inmate was feigning his illness, because, like I mentioned previously, we're not doctors. But if you get the medical staff on board to say that inmate was absolutely feigning an illness to get whatever, to do whatever, then the DR will stick. And if we start using this tool, then we can keep these inmates that are using chest pains for nefarious purposes to stop using that specific problem and keep the urgency in the officer's response that needs to be there when an inmate is having an actual cardiac event caused by chest or presenting as chest pains. Folks, I can't make it any plainer than that. We have to use the tools that we have to persuade these inmates to not utilize medical as a means of manipulation. Chest pains are amongst the biggest problem when it comes to that, because like I said, it takes away from staff's urgency when responding to an actual event that presents as chest pains. That's all I got. That's all I got for this one, folks. If you like the video, make sure you hit the like button. You want to see more, hit the subscribe button. Make sure you hit the bell for notifications when I post new videos, and comment. Leave me some comments, folks. As always, don't divulge any specific information. Don't compromise any ongoing investigations, and do not divulge any of your agency's policies and procedures. But leave me some comments. I want to know what you've been through. I want to know possible scenarios that you have seen in your career that will help further the careers of others. As always, make sure that we do everything we can to eradicate domestic violence from this world. Okay? If you are the victim, or you know the victim of a domestic violence situation, 1-800-799-SAFE. That is a domestic violence hotline. People at the other end of that conversation have the tools, abilities, and resources to help the victims of domestic violence. If you know the aggressor in a domestic violence situation, remember to say something to somebody. The worst thing you can do is nothing. And if you are the aggressor in a domestic violence situation, there's help for you too. The first thing you have to do is understand that you need that help, and then you have to ask for it. As always, love shouldn't hurt. I am my brother's keeper. I am my sister's keeper. Y'all stay safe behind the fence. It's Dave Smith at Correctional Officer Lifestyle. I'll see you in the next video.